Welcome, everyone. Happy Thursday. We're very glad that you could join us today for the We Honor Veterans webinar. We wanted to take this opportunity to do a 101 overview boot camp of sorts on good old hospice veteran partnerships. So joining us today and speaking will be myself. My name is Catherine Kemp, and I here am the Director of Veteran Services with NHPCO. So I oversee the We Honor Veterans program as well as our contract with the Department of Veterans Affairs. I did also want to give a shout out here behind the scenes is our Veteran Services Associate, M. Marge.
Hi, everyone.
I know many of you know her and love her. She, again, is always sort of behind the scenes and really serves as our point person as far as support goes for you partners. Everything from, helping you get registered to supporting you when you lose your, your unique identifier to log in and just being some general support. I am very happy today that we also have joining us the one and only Mary Davidson. She is with the Department of Veterans Affairs, and she is the VISN 10 Pain and Palliative Care Program Manager. Now, VISN 10 does serve Indiana, Michigan, and Ohio. She also serves as a Hospice Veteran Partnership Significant Interest Group Champion. Oh, that's a mouthful. So very happy to have Mary joining us today as well. Also joining us from the Community Hospice Partner side, we have Reverend Edward A. Teo. Many of you may be familiar with him as well. He is the board chair for the South Central Texas Hospice Veteran Partnership, He is also the veteran liaison and is a level 5 mentor. He was actually part of our level 5 pilot group. So with Curo Health Services, he does serve as manager of bereavement services. So before we get started, I just wanted to go through a little bit of housekeeping. I know that many of you are now familiar with Zoom, as this is our chosen platform to host these webinars on. When you join, you are automatically muted. We have quite a good number of people joining us today, and that's more just from the side of, I know that many people have been on calls and there's always a handful that just somehow can't be muted. So in an effort to minimize disturbance, everyone is automatically muted on this webinar. I do want to remind you that if you hover over the bottom of your screen, there is the option to use the chat box. So again, get on there, say hello to your fellow attendees. Please ask questions through here. You can, provide feedback. We will have a Q&A portion at the end of the webinar, and so M will be monitoring this, collecting questions as we go, and then posing them to the group once we make it through the main points. So just wanted to share that again with everyone else. But without further ado, let's go ahead and get started. So one thing, I actually did want to start this out just with a quick poll. We, like to get sort of a feel of what partners are joining us today. So the first question is, what We Honor Veterans level are you currently working on? Are you just starting out? You're a recruit and you're working on your level 1. Are you, sort of been with us for a while and you're jumping into your level 5 activities? Please let us know. But then aside from that, we also really want to know about what you're doing already with your hospice veteran partnership. Are you currently, a part of one? But more importantly, I want to stress the word active in that poll. It's one thing to say that you're part of a hospice veteran partnership. It's a completely different thing to be an active member in your community coalition. So let's see, we'll just give folks a couple more seconds to answer those. Okay, so let's see. Looking at the results, it looks like we have a pretty good mix of everyone joining us on the call. So a slight majority of you all are working on your level 1, but again, we also have some other folks who it seems have been with the program for a while. So I think the second portion with I am currently active in my hospice veteran partnership, the majority of you agree, so that just really warms my heart to know that you all are already participating in your hospice veteran partnerships. Okay, so getting started, what is the goal of today? So the We Honor Veterans team, along with our colleagues within the VA, really do try to make an effort not only to provide resources, but to kind of check in on things on an ongoing basis. And we have to say from the We Honor Veterans team side, without a doubt, the most frequently asked question we get is, what, pray tell, is an HVP? Once we walk through what it entails, the next follow-up question, without a doubt, is always, well, wait a second, I kind of get what it is, but why do I have to join this? So we thought that this would be a really good opportunity. Let's go back to the basics. Let's start from scratch and say, you know what, yes, we have tools for folks who are further along in their partnership, but we thought it would be more helpful just to give a really ground level overview. Let's get back to why you're doing this. We all know you're doing it because it's a requirement to be a We Honor Veterans partner, but more than that, what are you really gaining from it, and what is the benefit of having these relationships with not only other community hospice partners, but with your VA facilities and veteran-centric organizations as well. So let's get back to basics. We want to clarify for you the who, the what, the where, how, but again, as I mentioned, most importantly, the why. So I do have a few slides for the day that we're going to walk through, but more importantly, this is going to be more of a conversation between the three of us on the phone. I think it's really important, of course, from a programmatic standpoint, for us to be here not only to support you, but to reinforce why you're doing this. We also, always want to receive feedback from our friends at the VA. They are there to support you. They are part of these coalitions, and it's really important to hear their point of views as well. And also, without fail, whenever they join us, we always learn something new, and they're always really helpful as far as giving us some tips and tricks that we may not be aware of. And then thirdly, I thought it was really important to have a community hospice partner on here. While our team here knows the program in and out, we will not pretend to be in the same shoes as a hospice partner. Ed is the one doing the work on the ground. He's been there. He's been in, every scenario that you could probably pose to him. So we thought it was really important to get his feedback and have his input on this as well. Okay, so the what. Let's start from here. So what exactly is a hospice veteran partnership? A hospice veteran partnership is either statewide or community-based, and they are coalitions with the pure goal of ensuring that care is available to veterans and their families. So I want to stress the importance of veterans as well as their families. We all know that people sign up for this program with that intention of mind, putting the veterans' needs and wants first. We also want to reinforce, though, that they are part of a unit, and this is their family and loved ones and caregivers. And we all know, as being part of the hospice team, it does not stop with a patient, and it really does need to encompass the entire group that's with them. So again, what exactly is it? Hospice and VA staff provide each other with information about what services they provide, importantly, who is eligible for care, but most importantly, how do we resolve these issues that come up that are related to referral and reimbursement? We know that this is a common theme, and so having these connections with your local VA facilities and staff really is a step one and most important part of being a part of these hospice veteran partnerships. Okay, so the who. Who again does this actually entail? So for a hospice veteran partnership to be, I'll say, properly formed and on our roster, there are 3 requirements. One of them is, of course, our community hospice partners, and that's you. You have to be a part of these hospice veteran partnerships. I also want to stress the fact that it is often numerous hospice partners that are part of these coalitions. You're going to be working with others, with your fellow hospices, whether they are competitor or not. And I want to stress that again. This is all about working towards the greater goal of serving veterans and their families. And so in order to do that, you really do have to work as a community. So again, hospice partners, the next big key piece of HVPs are your VA facilities. Again, HVPs would be nothing without the VA facilities, and I know later on I'll ask Mary, many people don't know that HVPs actually started and are a program of the Department of Veterans Affairs, so I wanted to stress that again. It is not an HVP without a close relationship with your VA staff and facility. The other piece of an HVP are the veteran-centric organizations. So these other members can often include state hospice organizations, any veteran service organizations, and pretty much any other end-of-life coalitions that may be present in your state. And we'll go into veterans organizations a little bit later on, but I just wanted to stress that that is a key piece. And also that it's going to vary from HVP to HVP. Even though, for example, Quilts of Valor may be prevalent in many hospice veteran partnerships, it's not a requirement. And this is going back to doing what works for your partnership in particular. They're not going to be the same. And while we do have guidelines, we really do want to stress that do what works for you. There are no really hard and fast rules, and just keep your community needs always at the forefront of everything that you're doing. Okay, so going back to the who a little bit, I wanted to turn the phone over to Ed. Ed, again, as I mentioned, is a level 5 pilot partner. Now, we have been working with Ed for some time because he was in a very specific situation. These hospice veteran partnerships have been around for quite a while now. And as we all know, things can change, things develop. He was in a particular situation in that he didn't feel there was a community strong enough to serve the veterans in his area. So he did what, can be often difficult for others. He said, you know what, if it's not there, I'm going to do it myself. So I wanted to just turn it over to him for a minute to speak a little bit about who really was a part of building this from the ground up and sort of the importance of those different pieces.
Hello, everyone. Can you hear me?
Yep, we hear you.
Okay. Well, my name is Ed Teo, and I'm a bereavement counselor for Kindred Hospice in San Antonio, and I live in Military City, USA, we're in the middle of 5 different bases. We have approximately between 32 to 35,000 military stationed in San Antonio at one time, so I'm in the cream of the crop here. I may have an advantage over most of you, but I can tell you that there are veterans all over the United States, and even in the rural areas where you don't have a VA, you do have a lot of other organizations like the VFW and the American Legion and other people you can work with. But I began this with a group of 24 people, and what I did is, as Catherine said, is that I noticed that we did not have any kind of an organization here in San Antonio to pool resources. And so I looked up HVP. I started the HVP by inviting as many of the hospices, hospitals, and VA partners that I could locate, and invited them to an organizational meeting here at my office. And out of that, I got 24 participants, explained to them what the HVP was, and everybody was excited about doing something like this because they too were running against roadblocks as to who do you contact, how do you get into VA. It's almost like a brick wall was up against VA because nobody was allowed in. So I contacted all these people. We started the organization. I formed a board. I have a board of 7 members, and they're made up of all different hospices. One thing I need to stress is the mistake that I made is when I first started, we tried to target VA and almost drilled into ourselves that we need to get into VA, we need to get into VA, and tell them what we're all about. After a couple of declines and saying, you know, we can't talk to you, we realized that what we needed to do is instead of trying to go to VA to see what we could get from them, we went to VA to see what we could offer them. So we created programs and we created activities as a group to go to VA to say, this is what we can offer your veterans if we can work together. And so that was our way into the VA, is going into them and saying, we're not trying to take from you as much as we're trying to give back to the community. It's very important that VA understands that, because I think most of you can agree that you're going to run into roadblocks when you go in there to see about how many referrals you can get and how do you get their patients and so forth, because they're not interested in that. They almost feel like if we're robbing or stealing their veterans and their patients, and if we go in there with that purpose, then they're going to say, you know, we don't really need that. The other thing that we discovered is that there are many community partners in the industry that people aren't aware of. So we immediately started targeting all these contractors and people who were serving the veterans and tried to bring them into our organization. And we were fortunate enough to join with other already existing organizations. With the 24 members that we started with, I now have a referral list of over 180 sources that we can refer to, whether they're VA, whether they're hospices, or whether they're community partners. And you find these by going to VFW meetings, by going to other community programs, by going to American Legion meetings. Everybody, and also there are other meetings that are Rotary clubs. Rotary clubs are usually made up of a lot of veterans. And so you can get a lot of information from these other groups. And then when they find out what you're doing, most of them will join forces with you. The healthcare industry is an open field because they want help when they have a veteran and they're going to send them out to the community. They want to make sure that they have people that they can refer to when they're being sent out to the community. So we targeted all of the nursing programs in San Antonio and the social worker programs in San Antonio. And now we have partners on our board that belong to both of those groups. So that's basically the who, is making sure that you have something to offer the community more than what can you get out of the VA and what can you get out of the community. Is to be able to share with them that you have a vision of serving the needs of the veterans and their families.
Thank you for that, Ed. And I think you drove home a really important point, is that it all comes back to the intention that you go in there with. And this is not only with the program or with HVPs in general, but it really applies to any any collaborations that you're trying to start, especially walking in, to a VA facility. If it's the first time for you and you're trying to make an introduction, it's not about going in there to see what you can get. It's about going in there with the mindset of, I know what I can give, and I'm here today right now to voice that to them and make sure that I'm clear in communicating this. So thank you for bringing that point up, because I do think it's really important. So to sort of follow up on your who is involved, making friends in your community. Here are just some examples of members of HVPs all across the U.S. Of course, American Legion is really prevalent in most of them, but there are some other organizations that people sometimes forget about or maybe leave out. And again, this just depends on your community. Your high school ROTC, I can't stress to you how many partners have come to us, and this, ended up being, a volunteer son, for some reason voiced his want for being involved in veterans activities, and in came the entire ROTC to participate in honor or pinning ceremonies. Things that you may not think of can be a resource, and all you have to do is ask. The worst that people or groups can say is no, but at the end of the day, it's okay just knowing that you tried. I think there are many veterans organizations all across the U.S. We know this. There is no shortage of those. Keeping in mind, though, that, don't try to reinvent a wheel. More than likely, an organization that is serving the need that you may be looking for is more than likely out there. So reach out to us, look at our examples on the website. What you need, again, is probably already in place. Another organization I want to point out that we sometimes forget about is the Dream Foundation. They have a Dreams for Veterans program, which is incredible. We've worked with them for years. Their goals are in line with ours, and a lot of partners utilize their foundation for making, dreams or wishes of veterans at the end of life come true. And this can be something as small as flying their family out if they're not financially able to do that. So there are a ton of organizations out there, and it really is just about with connecting the ones that fit the needs of your HVP and your community. So something else that I really want to stress as far as resources go is please remember that your partners are your greatest resource. We talk about hospice veteran partnerships and building a community. The most important community, I would have to say, is we honor veterans. We in and of ourselves are a community. You and your other partners, just by signing up for this program, you're joining one. So you will always have somewhere to turn to. You will always have resources, whether that's the We Honor Veterans team, your VA, or your other partners. So I did want to point this out. As many of you know, we have launched the Level 5 program. One of the big aspects and requirements of being a Level 5 partner is that you are signing up to be a mentor. And this is something that's incredibly important and we've been working on for some time. We went in with the intention that who knows how to run a program better than our partners who have already been doing it. We're not coming in here for the case of, trying to pawn off any of our work on them. If you have any administrative questions or, anything related to customer service, please continue to come to the We Honor Veterans team. But if you need a mentor, if you want some advice, if you have questions, if you just want someone to bounce some ideas off of, turn to these folks. All of these partners have been in the program for years. The main point of contact has been the same, and in most cases, they have built this program from the ground up. So They know what they're doing, but more than anything, they love serving in this role. You know, knowing these folks, Ed being one of them up here, he loves being able to help other partners. You know, everyone is in this for the reason to better serve veterans, and that doesn't just mean within their own hospice facility or community. It means nationally as well. So I really do want to stress that. Please remember to reach out to your other partners. You know, they really are such a great resource, and they're never ending. So wanted to stress that as well. So as far as resources go, one other thing I wanted to bring up, and at this point I want to turn things over to Mary. What I do want to stress, though, that if there is one piece of information or one resource that you get from this webinar, please take this. This, I will repeat, is the fact sheet to end all fact sheets. So this actually came from the VA. And again, I'm going to turn it over now to let Mary speak just a little bit more about this, kind of where this came from and how you can best utilize it in your own hospice facility.
Hello to everyone. It's Mary Davidson. It's a delight to be with all of our partnering community hospices across the country. We in the VA have been working with partnerships since actually probably even before 2009 when I came on board. But actually in September of 2010, there was a huge commitment with the National Hospice and Palliative Care Organization and VA to look at really defining what it is that we wanted the We Honor Veterans campaign to kind of do. And I'm harking back to Catherine's introduction here, because at that time, similar to your group that you have for Hospice Veteran Partnership in community hospices, we started then a special interest group within the VA looking at partnering with our various hospice and palliative care programs to help them establish community hospice veteran partnerships. That was back in 2010, and really we wanted much of what you wanted, to commit to honoring veterans no matter where that veteran resided at the end of life, and making sure that we were breaking down the barriers. You heard Ed mention that sometimes trying to work with the VA was like running into a brick wall. So we knew that there were barriers to how we were able to help coordinate care for veterans when they needed care in the community, and that we needed to partner with you, and that we had lots of practices and tips and tricks of the trade about working with veterans, and that you also had lots of on-the-ground experience about how to best deliver care for people when they're in their homes at end of life. So it was back in 2010 that really this special interest group within the VA started. But I want to assure you also, as a way of hearkening back to what Catherine was talking about in the beginning of the program, that the VA is committed to working with our community partners. In fact, so much so that within our policy, which we call in the VA directives, we have a directive statement in there saying that each of the VISN, and the VISNs are the Veteran Integrated Service Network folks. So they're people like me who reside at the 19 different VISNs that work across the country and are in charge of making sure that hospice and palliative care is implemented for veterans that are a part of their geographic catchment area. So written into our policy is that people like me, our VISN palliative care program managers, are responsible for facilitating and establishing community networks so that care for veterans in the home at end of life are addressed and delivered. So, I want to to also let you know that each of our palliative care teams have a coordinator, and that coordinator is responsible for making sure that effective communications with community hospice agencies for transitioning veterans are in place for their local facility. So that, I think, perhaps sets the background for VA's commitment to working with all of you. You should never have that experience that you're running into a brick wall. But I do know, just as, you probably experienced turnover in your staffing, we experience turnover in our staffing. New people come on board, and we do our best to get them oriented and acclimated. But, many times that's in the setting of healthcare, quite frantic, and sometimes we need to go back and get those folks on board and connect them. So I appreciate when we hear comments such as Kathy Siebert had put in the comments earlier about not being able to work with the VA there in Daytona Beach. I appreciate knowing that we do try and circle back and help connect you as much as possible. And it's nothing personal. It's just the fact that we're, a large federal agency with lots on our plate. And, we're trying to do the best that we can. And sometimes that means that the best way of providing care to the veteran is to, focus on what the veteran needs are and not always pay attention sometimes to what people outside the agency are saying or doing, because many times, that gets complicated, as I know you all can appreciate. So I really want to make sure that I do, let you know that our commitment to partnering in the community with all of you is very strong, and I don't ever want your experience to be that you're not able to partner. And as much as possible, I can help facilitate that or help you get into contact with the people that you need to do for your regional outreach area. The fact sheet that Catherine has up here in the slideshow presentation is a wonderful way that we begin to address some of the questions in the community about who do I go to when I've got needs for the veterans that I'm caring for in the community, and find answers that I need for veteran care. So this VA fact sheet has been distributed across the special interest group in the VA and given to our palliative care Davidson program managers, and also distributed to our palliative care coordinators across the country at several points in time. So, and we encourage people to fill these out and to provide you with these contact names that help you know who should I call after hours, who do I get in touch with about billing processes, who can help me figure out how to get death benefits in place, and how do I, reach out and get assistance for veterans who are not yet enrolled in the VA system so that they can begin to use the benefits that are there for them. So this is a great fact sheet, and I would encourage you, if you have not received this from your palliative care coordinators that you work with, to share it with them and say, this was given to us through a Hospice Veteran Partnership. I wonder if you could just take a couple of minutes and complete this for me so I have a sense of how to work with you and best connect for our veterans that we're caring for in the community. And we know that veterans in the community, actually only about a quarter of the veterans in America will actually die in the VA. 3/4 of veterans in America die outside of the VA. So typically that's either a nursing home or in their home with all of you, or not connected to services at all. So, we have an opportunity there for 3/4 of the veterans that are in this country to really commit to helping partners in the community, which is, you, our nursing homes, our state veteran homes, and our hospice-based or home-based, primary care providers who actually work with our veterans in the community actually provide care for those veterans. So this is a great starting point, and I would just encourage you to go back to your facility and ask, do we have a fact sheet from our VA listing who our contacts are with the VA? And if not, that's a great way to just use that as an introduction to the palliative care coordinator at your VA and say, we're hoping to kind of fill in some information here so that we know who to turn to when we have questions. Could you help us get this information? So I'm curious, for those of you that are participating in today's call, I would love it if you could put in the chat if you've seen this fact sheet or if you have a fact sheet from your VA listing these contacts for you, so that you can use this as a way of communicating appropriately to the VA for when veteran needs become something that you need. So just put that in the chat panel if you would, if you've got one of these. Catherine, I'm going to turn this back to you if there's no questions.
Oh, well, thank you, Mary. I know that was extremely helpful, and I know a couple of people have asked. Em did include the link to this fact sheet. It is on the We Honor Veterans website. We will include that in the recording notes as well, so people can access it there. But it is up on the website right now under partner resources. Alternately, you can just go to the little search box at the top of the home page and enter fact sheet, and that'll take you there as well. But I really did just want to reinforce what Mary said. So thank you so much for giving that history and overview and really giving folks some information and guidance on not only what to do with this fact sheet, but how to access it. I think that's a really important point to make. You know, we try not to sugarcoat things here. Sometimes people do have some difficulty connecting with their VA facility. This is going to happen. As Mary mentioned, staff turnover is a huge thing, not only in the VA world, but in the world in general. You know, as hospice staff, you all know this happens as well. And I think a lot of times what can happen, and this is feedback that I've heard, is that partners reaching out to VA staff, the staff just may not be aware of it. It's not because they don't want to help, but oftentimes other things come up. But at the end of the day, they are doing what is best for veterans at the end of life. So as she stated, and I know, thank you, Mary, you've been super active in the chat box. Occasionally, if you are having trouble reaching out to someone at your VA, let us know. You know, that's what we're here for. Connect with the We Honor Veterans team. We will be happy to reach out to Mary or other contacts within the VA and just give them a heads up and say, you know what, our partner's having a little trouble finding the correct contact. Who should they be reaching out to? And we are always happy to do that. So please do not hesitate to do that. But thank you again for that, Mary. So when looking at hospice veteran partnerships, we wanted to reiterate that they are nationwide. You know, we have a roster currently on the We Honor Veterans website, but I really did just want to stress that these are either community-based or statewide. It just varies in your area. But more than likely, if you are looking for one already exists in your very own neighborhood. So on the We Honor Veterans website, again, under resources, there is a roster available. We try to keep this as updated as best we can. Sometimes we miss things or contact info changes. It happens. If you have any questions or feedback, again, reach out to us. But this is a pretty comprehensive list of all of the established hospice veteran partnerships in the U.S. I also want to point out just the primary contacts. Again, as this was an initiative of the Department of Veterans Affairs, oftentimes the main contact will be someone from within the VA. Other times, as is the case with Ed, it is a community hospice partner that started this, and they are the primary contact and chair, so their contact info will be up there. I just wanted to point that out as well. But again, go on there and reach out. Okay, so what happens if you are in someone like Ed's shoes and you realize you've gotten to a point, you may have come across a couple roadblocks or realized, you know what, my hospice veteran partnership has either puttered out quite a bit, or you know what, we may have a statewide one, but I really think that we need one in our local community. So what do you do when you reach that point? And at this point, I want to turn things over to Ed, again, to speak a little bit more about his experiences with building a hospice veteran partnership from the ground up, and then also just reiterate that there are many tools and tricks on the We Honor Veterans website, including a toolkit and, you know, pretty much anything you could need on the We Honor Veterans site. But again, want to hand this over to Ed so he can share a bit about his experiences and give some guidance to anyone who is looking to either start one or just sort of inject a little bit of life into one that already exists.
Hello, everybody. I wanted to just talk a little bit about how to, as Catherine said, to either start one or to bring life back into one that's already existing. I think the mindset has to be in the right place in order for this to work. And by that, I mean that we have to get away from the thought that we want to join this and we want to create this so we can get more referrals from VA. I had a difficult time with my sales team and some of the managers trying to explain to them that we're doing this in order to help veterans, not to build our census. But in doing that, you will get referrals back from it if they see that you're working towards the greater good. You'll get a lot of advertisement for your company. But the mindset has to be, first of all, let's serve the community, let's serve the veterans, and let's see, and then we can reap the rewards after that. So in saying that, when you create a board, make sure that you have a board that represents the entire community. Try and get not only from hospice partners, because I've talked to some boards that are made up strictly of hospice people, and they aren't including any VA and they aren't including any community partners. You want to try and get away from that, because then you're going to be focused strictly on the healthcare industry. And in order to make this a very successful entity, you need to bring in those other programs. You need to bring in VA representatives. And I'll tell you that on my board, first of all, let me explain that VSO officers are at different levels. The United States Veterans Association has VSO officers on their staff. However, in most states, the states have also hired and trained officers and that are VSO officers. So when you're looking at the VA, looking at a community partner for VA, also look into your own state to see if they have any state-sponsored VSO officers. And again, those are veteran service officers. These are people who help veterans apply for benefits, apply for death benefits. They do a lot of things for veterans. They're trained specifically to help veterans navigate the VA system. And they're also very helpful in doing training programs. I bring them onto our teleconferences, and I'll have them speak, about different topics, but they're a great resource. So look up your veteran service officers and try to make them part of your board. The other people that are very important to your board are the community partners. There are a lot of organizations, probably in your own community, that get funding from the VA in order to provide services to veterans. And to give you some examples, we have a construction company here in San Antonio that was given a grant in order to do remodeling of bathrooms, to build ramps, to do other things like widening doors in a home where a wheelchair can fit. And specifically, that money was given to them just so that they could work with veterans. They're not part of the VA, they're a community partner, and so it's important to have them as part of your board also, so you can have a greater range of resources. The other thing is that once you start this program, you really need to strategize and decide how you're going to help the community. And the way we decided we were going to do that is that we were going to provide as much training and as much education as we could so that people in the community that were looking for help would know where to go to. So I do, sometimes I do monthly, like in September, August and September, we're having a teleconference and I have a speaker from VA that's going to come and talk about a new program that they're starting, or they have. It's called Whole Family Life Services, I think that's what it's called. And so he's going to come on to our teleconference. He's going to provide education to all of our community to show them what's available to the VA. You want to help educate them on access. How do I access VA and how do I navigate it? One of the best boards that I work with right now is called the Disabled American Veterans Association. They train a lot of VSO officers and they have them on their staff. And these people work for free. These are veterans who volunteer to go out into the community and help other veterans and families to navigate the system, help them fill out benefit forms, and get them enrolled in VA. Awareness. You want to make sure that you're not only your board, that everybody who's calling in on these programs are aware of what is available out in the community. The more people that know and the more people that you educate, the more veterans and families you're going to be able to help. So being active, strategizing, educating, building a relationship is probably the most important thing that you can do as a hospice veteran partner, because there's a lot of need out there and people are hungry to learn and to know. They just don't know where to turn to. And you can be that resource for most people. You can be the place where that they can pick up the phone and call and say, can you tell me who can help me with benefits? Can you tell me who can help me get a ramp for my wife so I can take her out of the house? So find out all these programs in the community, build a relationship with them, build a referral source that you can share with other people, and that will create a hospice veteran partnership that people will not only want to belong to, but will want to refer to. So I hope that helps you a little bit, and understand that you are a necessity in the community, not only for hospices, but for anybody who deals with veterans in the community.
And Ed, this is Mary. If I can just maybe, first of all, reinforce what you said about how important it is to make sure that as you're building your list of who you can have as resources, that you consider a collaborative hospice veteran partnership. I know for several of our hospice veteran partnerships, the leadership for that really is both VA and community. And I think that really works out the best to look at sharing resources and putting together an agenda that makes sense for your hospice veteran partnership. So if your VA person's kind of struggling with, like, where do we begin, sometimes it's refreshing to have a partner say, how can I help you provide leadership for this. I'm willing to, provide a space to meet, or I'm willing to, see if we can connect with our state hospice organization so that, we have the ability to collect some funding, support food for meetings, and those kinds of things that are often huge challenges that exist within kind of a VA and what we're ethically able to do in the name of veterans. So I would highly encourage you thinking of setting up or continuing maybe your hospice veteran partnership with that co-leadership model.
That's a very good point. I want to stress also that when we were going through the process of trying to build our board, I recognized that most of the people that were coming into our board were just as clueless as the community about what resources were out there. So because I had been doing it for long, I had a large list of referrals. And so what I do now is that I have a monthly board meeting, and I take my board members to a different location every month, whether it's the American GI Forum or whether it's a VA or whether it's another community resource. And we have each board member provides lunch at a different month, and then we have a speaker from that organization will present on their program, so that it gives them a visual and a hands-on of what's available out in the community, rather than just saying there's a VA forum, a GI forum out there in the community, make sure you use them. Now they get a hands-on experience, and they go to the site, and they're able to share that with the community as well. So having your board knowledgeable is probably one of the best things you can do, so that they in turn can turn around and help educate other people.
Well, thank you both for pointing those items out and really reinforcing the importance of not only having a strong leadership behind your hospice veteran partnership, but also ensuring, as Mary mentioned, that there are representatives from both community hospices and from the VA, and just really want to stress the importance of that again. And I love that you shared that, Ed, that going in, sometimes it can be the blind leading the blind, but that's okay. You know what? Everybody's there to learn together, and the resources that you do need do reveal themselves when you need them. So I just wanted to say thanks again for pointing that out. I did want to just quickly point out, we do get a lot of questions from partners regarding events, when it comes to hospice veteran partnerships. And while this is an aspect of having a partnership, again, this is not a one-size-fits-all sort of program as far as that goes. Our partners are the most creative bunch of people, I have to say, and we see examples both big and small. And again, it's not a one-size-fits-all, and you really do need to focus on what is best for your community. I know that going in initially, it can be overwhelming because you hear from partners that are having these huge Welcome Home Vietnam Veterans Day events and, these giant parades, and it's not about that. It's more about creating a space. I do want to stress, I like to tell just a quick story about veterans coffee events, and this is something that I know Ed's familiar with. But when I started working with We Honor Veterans, one of the first events that I was fortunate enough to go to was by Don Timmons. I'm not sure if he's on the phone, but he is with Trellis Support in the Carolinas. One of the first events I went to was he was doing a Pearl Harbor event, and it was larger and more spectacular than anything I could have ever imagined. But the most important moment during that event, you know, beyond the singing and the dancing and the salutes and the readings, was at the end when I went up to meet a Pearl Harbor veteran. And he just introduced himself to me and said hi, and was mentioning that he'd had sort of a tough year as his wife had passed away. And tears started to well in his eyes. As soon as that happened, I'm not kidding you, were swarmed by his fellow veterans who were part of the coffee group. They were there as a support system for him. You know, again, it was a very emotional time for him, and he stated, you know what, I don't know if I'm going to make it to the end of this year. And one of the other men that was there kind of joked and said, well, you kind of have to make it to the end of the year because you're my ride to the next Veterans Coffee, so I expect you to be there. But it's just those small things that are really important. It's not about, you know, doing everything. It really is just about creating the space and environment for veterans at the end of the day. So just wanted to point that out really quickly. So I did want to end on a little bit of a why. I know that we're almost reaching the top of the hour, but I did want to hit on this. You know, obviously from a programmatic perspective, I can't stress this enough. It is a requirement of being a We Honor Veterans partner to be an active participant in a hospice veteran partnership. It's not just about signing up and saying, yep, I'm part of it. I can't stress the word active enough. And so I just wanted to take sort of the last few minutes to turn to Mary and then Ed about why this is important and what are some of the takeaways that you within your realm have seen. You know, what have hospice veteran partnerships brought to your different realms?
So this is Mary, and I'll just quickly kind of reiterate what I put in the chat box about the role that partners had around helping to get veterans enrolled in VA early. It makes such a difference when we can connect them with benefit resources prior to an active dying moment. And I know you all appreciate that because late referrals are something that the hospice industry has dealt with for a long time. But our partners have been so proactive around, you know, speaking with veteran populations, providing services for veteran populations. And you think about it, 3/4 of that population are probably not enrolled in the VA, so they're not going to be able to get benefits that are specifically entitled to them by federal law. So, you know, doing that is huge. And the other really great outcome, if I had to only pick a few, you know, another really great outcome is that we have seen our veterans die with so much honor and dignity as a result of the programming that you all have put into place. And, you know, in many ways, you've served as a beacon for the VA as much as the VA served as a beacon for you in terms of, you know, really caring well for that veteran. And it just is incredible to think that before 2010, none of this even existed. And what you have done in breaking down those barriers for getting care for your veterans has fueled our desire to work with you in the VA as well. So we thank you for that.
This is Ed. I just want to share one quick note that one of the reasons that I started this program was I had a personal interest in this, in that my wife was diagnosed with Alzheimer's, and I became a caregiver for her. And I had a need that the VA couldn't fulfill or couldn't help me with, and that was I needed a ramp so that I was able to take my wife in and out of the house and be able to take her out with me. There was a community program in San Antonio called Texas Serves, and they, again, are another program that gets funding from the government to provide resources for veterans. I heard about the program, I gave them a call, Within 2 days, I had a ramp built at my house. While the caseworker was at my house, she asked me, do you have any other needs? I hadn't even thought about it, but she said, who else takes care of your wife? And I said, just me. Within a week, I had a caregiver that they allowed me 24 hours a week for caregiver services. And so now I was able to get out of the house to go get groceries and not worry about who was going to take care of my wife. All this was because I was building a referral source in order to help veterans, and I ended up being able to help myself with that and my wife. But the why to this is that there are many, many, many people in the community that have given up simply because they find it difficult to navigate the VA system. And so I started taking these VSO officers into the nursing homes where I found veterans. And rather than them having go through and navigate themselves on the computer, these VSO officers will sit with them and help them fill out these forms and help them apply for benefits. I had a presentation that we did at a nursing home, and afterwards a lady came up to me and she said, I heard you say that there were benefits available for spouses. And I said, yes, there are. Well, after she brought me all her paperwork, we discovered that her husband had been granted 100% disability 20 years prior and had never claimed it and never told his wife. So I put her in touch with a VSO officer. She is now getting a monthly check, and they're looking at seeing if the government will approve her getting 20 years back pay for those 20 years that her husband never claimed. We don't know if that'll happen. But again, all of this is part of the why. Why? Because there's a great need in the community, and not everybody will reach out. But if we reach out to them, maybe we can help some veterans and some family members.
Oh, well, thank you both so much for sharing those. Unfortunately, we are sort of a little bit over time, so we are going to have to wrap it up. Thank you again. We have had a ton of questions coming through on the chat box. I know Em has been responding to stuff. Mary's been very active on there as well, so thank you for that, Mary. I know folks appreciate that. If you do have any further questions that weren't answered during this webinar, reach out to us. Submit them to veterans@nhpco.org, and we'll be happy to answer those. I did want to thank you all again for joining us today. This recording will be available and up on the We Honor Veterans website next week. Again, submit anything and we'll get back to you as quickly as we can. But I just wanted to take a moment again to thank our good friend and colleague, Mary Davidson, as well as Reverend Teo for joining us today. This program would be nothing without the input and support of not only you as VA staff, but our community partners as well. So thank you both, and thank you all for joining us today. We hope that it was helpful, and we look forward to having another caller webinar within the next month or two. So stay tuned for that. Thank you, everyone.
Thank you, Catherine.
Thank you.